Hi everyone, it's Lila from Silverbirth, and today we are going to be talking about water birth. I'm going to be answering any questions that you've ever had about water birth, so let's get to it. Ever since I was a kid, I have loved swimming, loved being in the water, and I found out at a pretty young age that water birth was a thing, so I was always interested in it, and I was just like, yeah, when I grow up, that's the way I'm going to give birth. So I hope that one day I'm able to experience that for myself. And I hope one day soon as a doula that one of my clients gives birth in the water. I've had many of my clients labor in the water and they love it. There's so many benefits to it, but no births as of yet, so hopefully soon that will happen. What is water birth? Well, it's exactly as it sounds. It is giving birth in the water, whether that's a birth pool that you rent or your bathtub or a birth tub in the hospital. And I'm sure you have a lot of questions, and we're going to get to it in a minute. But first, a little backstory. For thousands of years, women have actually been giving birth in the water, from Egypt to Hawaii and New Zealand and so many places all across the world. And then it was lost for a very long time. The first story of a modern birth that was recorded in history was in 1805 France. There was a woman who was having a very long, very difficult labor, and they got her into a bathtub just to relax her, and almost as soon as she got in there, her body just relaxed, she dilated the rest of the way, and the baby basically just slid right out. And then for a while, that was all that anyone had ever heard of it. And then in the 1970s, French and Russian obstetricians were looking for ways to help babies transition into the world that was much calmer, and the concept of water birth started to really take off. And in the 1980s, a French obstetrician named Michel Audent, I think I'm saying his name properly, he is a water birth pioneer, and he actually started installing birth tubs into hospitals. And then ever since then, it's been getting more and more prominent. So, what are the benefits of water birth? First off, you have decreased pain, decreased anesthesia use, decreased duration of labor. The water supports your weight, and it makes it very easy for you to change position and for your pelvis to open up. The buoyancy of the water improves your circulation, which gives your uterus more oxygen, which means more oxygen for the baby and also less pain for you. It's peaceful. Who doesn't love getting into a nice, relaxing bath, getting all calm and peaceful, and who wouldn't want to give birth that way? You become relaxed, so your stress hormones are reduced. Because your stress hormones are reduced, your oxytocin flows more easily and you dilate a lot quicker. There's a reduced risk of tearing. The water makes your skin very supple and elastic, and there's a way smaller chance of you tearing your perineum. It reminds the baby of amniotic fluid that it's been living and growing in for the last 9 months, so it's a very nice transition for him into the world. Your partner or even your children can join you in the birth pool if you like. Many women who have had both a land and a water birth report that they are more satisfied with their water birth experiences. What are the risks of water birth? I just want to preface this by saying that in clinical trials, it's very hard to research water birth because so many different factors determine the outcome of birth, such as environment, your healthcare professional, the number of vaginal exams you get, and a lot of other things. They are not recommended for women who have any type of complication like preterm labor, if they have herpes or HIV, or if they have preeclampsia, which is high blood pressure and caused by pregnancy. There is risk of fetal distress if the water temperature is too hot, so that's above 98 degrees Fahrenheit, 37 degrees Celsius, or if you don't stay hydrated enough, so keep drinking water. There is risk of infection if the birth pool or the tub has not been cleaned properly. So if you have rented a birth pool, always be sure to use the disposable liners that it comes with. If there is meconium present when your water breaks, it is not safe for you to be in the pool. The meconium is your baby's first poop, and it's easy for him to aspirate that. Will my baby be safe? This is a very common question because, of course, everybody wants their baby to be safe. And studies have shown that water birth is just as safe, and some argue safer, than land birth. When your baby is growing, they're in amniotic fluid in your womb, and they don't breathe. They breathe through the placenta and the umbilical cord, right here in this little guy. They have a dive reflex, which means that they don't breathe until they touch the air. So as long as your baby stays underwater until he's fully out of the vagina, he's not going to breathe. He just has to remain unstartled and then just swiftly lift it up out of the water when he's fully born. And he won't breathe until he touches the air. So he will be safe. Research does show that there are rarely adverse effects to water birth, but studies also show very rarely that there are adverse effects to a lot of medicalized procedures as well, like epidurals and Pitocin and C-sections and everything. I don't say this to scare you, but rather just so that you're informed, because that's the most important thing, informed consent. There are risks and benefits to any procedure and anything that you have done when you give birth, and you deserve to know anything that can happen so that you can make the right choice for you. Having a water birth. You have so much choice when it comes to birth, and even when it comes to water birth. You can do it in a hospital, because so many rooms now have a tub built in. You can do it in a birth center, or you can even do it in your own home by renting a birth pool. So if you rent a birth pool, it's best to set it up about 2 weeks before your due date, just because you never know when you're going to give birth. And this way you are good to go. You just have to fill it up when you're ready. Depending on the equipment that comes with it, you just hook it up to the sink through a hose and fill it up, and you can also adjust the temperature that way by just turning the hot water on. If you don't have that option, an alternative is heating water on the stove and just pouring it into the birth pool, but be sure that it is far away from the mother. You do not want to burn her. You can get in the tub whenever you like. You can go in and out and back in again. Research shows that it is most effective when you're in very hard active labor, because all of the stress hormones that you've created will just transform themselves into oxytocin, and you will dilate really quickly. If you have a doctor, they're going to want you out of the birth pool so that they can check you. If you have a midwife, they're okay to do it in the birth pool. They're very used to that. And they're also very used to sieving any birth debris out of the pool, because we know it is a very common thing. Sometimes women do poop when they are pushing the baby out, but midwives have seen it all and they have no problem cleaning the pool for you. After the delivery, they will want you out of the pool, whether you have a midwife or a doctor, just so that you can deliver the placenta on land so they can monitor your blood loss, just to be safe. If you're timid about delivering in the water, you can still labor in the water. You don't have to push yourself to do anything you don't feel comfortable doing, but there are many benefits to even just laboring in the water, so that's always an option for you. Water birth is not for everyone, and some women swear by it. Every birth is different, and every woman is different, and it is up to you to find what feels good for you. I encourage you to do your own research. I hope now you feel more informed and empowered about it, but do your own research. And what it comes down to is just find what feels good for you and then do that. Until next time, I'm Lila. Have a great day.